Good morning, everyone.
Good morning.
Whenever I talk about reopening Baltimore City, I said we need to see a decline in the numbers, we need to see an increase in our testing capacity, and we need to have a robust contact tracing program in place. Well, Baltimore, I'm extremely excited to announce the Baltimore Health Corps Initiative. This will be an innovative pilot program to equitably address the city's public health and employment challenges. This $12 million private-public partnership was mobilized by an initial $2 million commitment by the Rockefeller Foundation, who have been amazing partners as we work tirelessly to stand up this critical initiative. The Baltimore Health Corp is designed to address the city's interconnected economic and public health crisis caused by the COVID-19 pandemic. The Baltimore Health Corps will recruit, train, and employ more than 300 residents who are currently jobless due to the pandemic to serve as contact tracers, care coordinators, and community health workers. Health Corp staff will deploy to address critical COVID-19 needs in Baltimore's most vulnerable communities, performing three key functions: public health outreach education, contact tracing, and care coordination and social support. The Baltimore Health Corps is the first of its kind because it will target hiring individuals who have recently lost their jobs due to the pandemic and live in communities hardest hit by COVID-19. As community health workers, including those without previous health care experience, all 300-plus members of the Baltimore Health Corps will receive a living wage and a stipend for health insurance to serve as full-time trusted contact tracers and care coordinators in our community. This kind of lift requires many partners working together for the benefit of the public. To date, we have raised a total of $9 million for this program. The Rockefeller Foundation committed an initial $2 million for the pilot. The city has made a $4.5 million commitment to support this initiative, tapping into our CARES Act funds. Additional private funders have contributed nearly $2.3 million in support and includes the Annie E. Casey Foundation, Bloomberg, Care First, the Frank Merrick Foundation, the Gold Seeker Foundation, OSI Baltimore, PepsiCo, the Rouse Foundation, the Stallman Foundation, the T. Rose Price Foundation, and the State of Maryland Department of Labor. We still have a funding gap of $3 million and are asking other private donors to join us in this effort. The Baltimore City Health Department, JPIGO, the Mayor's Office of Employment Development, Baltimore Corps, Healthcare Access Maryland, and the Baltimore Civic Fund are partnering to operate the initiative. I'm extremely grateful to this extraordinary coalition of philanthropists and operating partners who have worked tirelessly to launch this groundbreaking model in Baltimore City. And with that, I will turn it over to our Health Commissioner.
Thank you, Mayor Young, for your leadership during these difficult times. As of this morning, Baltimore City has seen 5,801 confirmed cases of COVID-19 and 258 confirmed deaths due to disease. Today, in response to the need for more contact tracers here in Baltimore City and in acknowledgement of the disparate impact the COVID-19 pandemic has had on our workforce, I'm excited to announce the launch of our Baltimore Health Corps initiative. With this multi-million-dollar partnership, Baltimore City will be hiring over 300 residents to conduct contact tracing, care coordination, and other public health activities for the duration of the Baltimore City COVID-19 response. These positions will include contact tracers, care coordinators, directors, supervisors, managers, and operational support staff. This public-private partnership would not be possible without the support of Mayor Young and his executive team, the Mayor's Office of Employment Development, Baltimore Corps, Healthcare Access Maryland, JPIGO, the Rockefeller Foundation, the Baltimore Civic Fund, and the many funders who've been assisting with the Baltimore City COVID-19 response. With the Baltimore Health Corps initiative, we will be able to dramatically expand the Baltimore City Health Department's capacity to respond to the COVID-19 pandemic, while also putting some of the city's residents whose jobs have been lost as a result of the pandemic back to work. The majority of these hires will be for the Baltimore City Health Department to assist the city in contact tracing. As a reminder, contact tracing remains one of the most important tools available to help the health department battling COVID-19 as we work to track and slow the transmission of disease. Our Baltimore Health Corps contact tracers will play a key role in tracking the spread of COVID-19 here in Baltimore City, providing valuable information on how to isolate and quarantine safely, notifying residents of their test status for those who've been tested at our community-based testing sites, and entering important data so we can continue public health surveillance and keep our city residents safe. In addition to our contact tracing teams, the Baltimore Health Corps, along with our partner, Healthcare Access Maryland, will be hiring local residents as community health workers and supervisors, increasing our capacity to provide essential care coordination services for the residents of Baltimore City. Healthcare Access Maryland will continue to serve as the care coordination entity for our pregnant moms and families with young children and will help adults coordinate their social needs such as food, housing, utilities, and services, especially crucial now. We have been closely working with the Mayor's Office of Employment Development, Baltimore Corps, and the Mayor's Office of Immigration Affairs to ensure that we are equitable in all of our hiring practices. We are looking to hire people who have great communication and problem-solving skills, and individuals who have experience in customer service or in the fields of healthcare, education, or social service. We will preferentially hire Baltimore City residents who are currently unemployed. We are also looking for residents who speak multiple languages or languages other than English. We are now accepting applications. For more information, please visit www.coronavirus.baltimorecity.gov/Baltimore-Health-Corps or www.baltimorecorps.org/Baltimore-Health-Corps for more information. I would now like to turn it over to Jason Perkins Cohen, Director of the Mayor's Office of Employment Development.
Thank you, Dr. Duraza. It gives me great pleasure to be here. We all know that we're facing an economic crisis as well as a health crisis. This initiative tackles both because our city needs both. And we will not call this initiative a success unless we both address the public health crisis and provide equitable employment opportunities for our citizens. We all know that the best prescription for an economic crisis is a job. And as you heard, we're creating over 300 of them. These aren't just any jobs, these are good jobs with a strong workforce development component. And let me highlight a few of those components. First of all, they pay a good wage. They will pay between $35,000 a year and $39,000 a year to start. They provide critical built-in workforce supports, including access to legal services, access to mental health support, financial empowerment counseling, and career navigation. They increase access to opportunity by offering free community health worker training prior to the job's start. All of these supports are intentionally designed so that new workers can both perform at the highest level during this health crisis and yet at the same time plan for their future. And with careful planning from the start in a sector, healthcare, that is here and growing with more career pathway job opportunities, we fully expect the future to be bright. As we're fond of saying at MOED, get a job, build a career. Last, I want to address what this means more broadly. This initiative is expected to pump $11 million in wages and benefits to these workers, jobs that would not be available otherwise. It will make an enormous difference to these workers, their families, and their communities, and will serve as an economic stimulus for our economy. I'm grateful for the partnership with Dr. Duraza and her team as we've embarked upon this intentionally to accomplish both goals of addressing the healthcare crisis and the employment crisis, and I look forward to sharing our progress. And now it gives me great pleasure to introduce one of our early supporters, the Director of the Open Society Institute, Baltimore, Danielle Terrain. Thank you.
Thank you, Jason. So I am so pleased to be here today with so many excellent partners to talk about this important work. In March, when we began to realize the deep impact that COVID-19 would actually have on our communities here in Baltimore, it became clear that no single agency, no single funder, no single community group, or even leader would be able to address alone the enormous impacts that this would have in Baltimore. At OSI, we look for ways that we could actually leverage our expertise and our funds in collaboration with other partners to help those most at risk of falling into extreme hardship, including those who are unemployed and those who are formerly incarcerated. Given Baltimore's strong sense of community, it was no sense of surprise that people from all sectors came together in this effort to collaborate and find solutions. Baltimore Health Corps, to us, is exactly the type of innovative, impactful, public-private partnership that OSI is looking to support in response to COVID-19 and a multitude of needs in the city. The initiative is particularly crucial because it looks at the mid and long-term impacts of COVID by promoting job creation and job access for populations of workers that are disproportionately impacted by the pandemic and historically marginalized from the job market. So we look forward to working with all of the partners here today to implement this initiative and also use it as a model for Baltimore and future collaborations across the country. So thank you again. Next, I'd love to introduce my colleague, Tracy Kodak, CEO of Healthcare Access Maryland, to share a few comments.
Thank you, Danielle. Healthcare Access Maryland is pleased to announce its partnership with Baltimore Corps, and I'd like to thank the officials, funders, and the Rockefeller Foundation for supporting this initiative. HCAM is a 23-year-old nonprofit that was founded in Baltimore City to support Medicaid recipients with enrolling in managed care and providing short-term care coordination services. Expanding statewide in 2011, HCAM became the central navigator for the newly formed Maryland Health Benefit Exchange to assist consumers with health insurance enrollment. Currently, we are in 6 counties across the region to assist consumers with health insurance navigation under the Affordable Care Act. But HCAM is bigger than health insurance. Our legacy is assisting clients with navigating the social determinants of health that truly impact their well-being. There are items such as housing instability, food insecurity, and workforce development. We serve as the hub in these programs, staffed by community health workers or care coordinators to support clients in accessing these key resources while helping them reach their overall health goals. With over 220 staff, we serve over 120,000 individuals and families statewide, many who are living in communities disproportionately impacted by chronic health conditions, low socioeconomic status, and low birth outcomes. As part of Baltimore Health Corps, our team of community health workers and care coordinators will support these clients identified by contact tracers needing specialized wraparound services. This is our expertise, and we are proud to be able to support this larger workforce development initiative. HCAM is making Maryland healthier by connecting residents to insurance and care, educating the community about healthier living, and advocating for a more equitable healthcare system. Thank you for allowing HCAM to play a significant role in Baltimore Health Corps. And at this time, I'd like to introduce Dr. Alan Dimiba, JPIGO Senior Vice President for Technical Leadership and Global Programs.
Good morning. I'm Vice President for Technical Leadership and Global Programs at JPIGO, a global health nonprofit and Johns Hopkins University affiliate. It's a great honor for JPIGO to begin work in its hometown of Baltimore. For nearly 50 years and in over 150 countries, JPIGO has created and delivered transformative healthcare solutions to the world's toughest health challenges. The coronavirus is the newest one. It's energizing to me and to our team to contribute to our years of experience in addressing these problems here where many of us live. We want to thank city officials for their leadership and inclusion. We want to thank the funders, including Rockefeller Foundation, Bloomberg Philanthropies, and others for their commitment and support. JPIGO is prepared and ready to share our expertise and experience in the prevention and treatment of infectious diseases to this moment. Having participated in effective contact tracing around the world for HIV, tuberculosis, and the recent outbreak, and having worked to end Ebola, SARS, We are eager to address COVID-19 here in Baltimore and build a strong health workforce in the fight against this pandemic. Jupaigo has vast experience establishing, training, and developing community health workers for this purpose. These health workers provide testing, counseling, and linkage to care and treatment services, and serve as a trusted liaison between families and health providers. This specialized type of outreach and follow-up require a dedicated, patient, and skilled workforce, which, supported by Jupaigo, shares our commitment to saving lives, improving health, and transforming futures here in Baltimore and worldwide. Thank you for your partnership. Now it's my pleasure to introduce Fagen Harris, President CEO of Baltimore Corps.
Good morning, everyone. I'm so pleased to be here. I want to begin by expressing gratitude to Mayor Young, the Baltimore City Health Department, the Mayor's Office of Employment Development, Jerry Bird, Cheryl Goldstein, the Rockefeller Foundation, the Annie E. Casey Foundation, PepsiCo, Care First, OSI Baltimore, Jupaigo, Healthcare Access Maryland, and all of the partners that have come together to create this extraordinary intervention to help the citizens of our city. I also want to acknowledge my colleagues at Baltimore Corps, led by my colleague Sarah Fleming, for their very hard work in helping to pull this together. Partnering with the city to enlist our residents in the hard work of making our city stronger is at the core of what we do at Baltimore Corps, and has been our track record since 2013. The disproportionate impacts of COVID-19 on Black and Indigenous communities demand a response that elevates the community needs and is rooted in community-driven models. As we're seeing across the world, trust is vital to making contact tracing and community health work successful. Residents need to be comfortable sharing their information with community health workers and to trust the information they're receiving. The foundation of this initiative is focused on elevating community leaders to respond to the public health crisis, to bring the most trusted local voices to the forefront of our city's response. Equity and racial justice are at the heart of our mission at Baltimore Corps, and we are proud to bring these values to this effort. In our efforts this morning, we were reminded of Franklin Roosevelt and the New Deal public works systems that put in place as a response to the Great Depression. In response to a crisis in the 1930s that left millions unemployed, in the same way today, following the COVID-19 crisis that has left countless people unemployed, this effort will put people to work and help build a healthier, stronger community. Simultaneously, public health and public works models are in need of modernization, and this initiative provides an opportunity to ensure inclusive, coordinated response to the current crisis. This is truly groundbreaking. It's a best-in-class initiative. It's something that I think the United States can pay attention to here in Baltimore City. It's a good day for Baltimore. We should all be very proud. This initiative is an opportunity to establish a national model for other cities to replicate and continues to move Baltimore closer to the vision of being the best place in the world to change the world, and establishes an effort that is grounded in engaging the community who are closest to the challenges and the most important solutions to those challenges. And so it gives me great pleasure now to call up Otis Raleigh III, the Senior Vice President of U.S. Equity and Economic Opportunity at the Rockefeller Foundation. Thank you.
Good morning, everyone. Mayor Young, Commissioner DeRaza, Director Perkins, Cohen, and all other partners here in person and virtually. It's an honor to stand with you today, even 6 feet apart, to announce this vital partnership. On behalf of the Rockefeller Foundation and our president, Dr. Raj Shah, I'm so excited to support this effort to address both the need for training and employment while also building the public health infrastructure of this great city. Again, I'm Otis Raleigh, and as part of our global response to COVID-19, we announced that we would advance $50 million in grant making and redouble our efforts in 3 of our 4 primary pillars of work: health, food, and the initiative that I have the honor of leading, equity and economic opportunity. Rockefeller did this because we know that America is being hit with both an old and a new pandemic. The old pandemic of racism and the new pandemic of COVID-19. Without equal access to tests, treatments, and vaccines, we will not be able to end the COVID-19 pandemic and therefore prevent further unnecessary deaths, particularly among the African American community, which due to structural racism is often less resourced, more exposed, and less protected in this fight against COVID-19. So because we believe Black Lives Matter, health is one of our pillars, and we are dedicating millions toward testing. According to the USDA, Black households are nearly twice as likely to be food insecure as the national average. We know that more than 30 million school children, many Black and brown children, rely on school meals to eat at a time when schools are closed due to COVID-19. So because we believe Black Lives Matter, food is one of our pillars, and we are dedicating millions toward food access. The COVID-19 economic crisis is disproportionately hurting African American households. Higher than the national average, 1 out of every 3 African American households have had 1 or more members file for unemployment. We are also more likely to be among the 4 and 5 part-time workers who have lost their job or had pay reduced. You cannot eat, you cannot have shelter, you cannot clothe yourself and your family without income. In many ways, you can't live. So because we believe Black Lives Matter, equity and economic opportunity is one of the Rockefeller Foundation's pillars, and we are dedicating millions toward budget and tax policy and place-based investments to increase access to income, capital, and benefits, and anti-displacement for Black and brown families and businesses. The Rockefeller Foundation is over 100 years old. From our very first grant in Baltimore in 1916, establishing the Hopkins School of Public Health, to our 1960s grant launching a pilot to increase the number of Black principals so that more school leaders reflected the diversity of the students in the classroom, through to today's grant to advance the Baltimore Health Corps, Rockefeller has built a reputation as a trailblazer that convenes substantive partnerships and sparks innovation for transformative change. Has there ever been a time greater than today when a transformative change is required? Not tinkering around the edges, not incremental improvements, but transformative change. Well, transformative change can only happen when there are committed partners. The Office of Employment Development, Health Department, Baltimore Corps, HCAM, JPEGO, partners. Open Society Institute of Baltimore, PepsiCo, Goldsecker, BCF's COVID Emergency Response Fund, partners. Baltimore Civic Fund, Annie Casey Foundation, France Merrick, and Care First, partners. No transformative change occurs without real, prolonged partnership. And Rockefeller is so grateful to be partnering with people and organizations who are committed to Baltimore, and more importantly, to Baltimoreans. Many of you know that I have spent the majority of my adult life in this great city, and I see firsthand the transformative potential of our work together. Our team remains committed to supporting communities like Baltimore and encouraging investments that will give workers the stability they need to ensure a better and more equitable future. It is so important that we do this while also building the nation's public health infrastructure. Thank you so very much, and I will turn the mic back over to our Honorable Mayor.
Excuse me, thank you, Otis. I really appreciate all of our partners for all of the work that they have done to put this together and for your commitment to the residents of Baltimore. We'll take a few questions now. About this part. Thank you.
No questions on the announcement?
Thank you.
Okay.
Morning, Mayor.
Good morning.
I just wanted to get your thoughts on Tuesday's primary election.
I thought we was going to do that separate.
Oh, we'll do that. I'm sorry.
Yeah, okay.
All right. This is,
Any questions for this part?
do we know how soon these folks could be hired in terms of the contact tracers?
Well,
That's
you know, we
question.
just made
This
the
is
announcement. They have
just,
to apply.
Will be.
They have to apply.
Months or something, but.
We just made the announcement. They have
Okay.
to apply for the positions. I mean, if you want to answer, you can go ahead. We just made the announcement. They have to apply.
As the mayor indicated, we announced this initiative this morning. The link is live on the Baltimore City Health Department website and the Baltimore Corps website. Folks can begin to apply today, and we are hiring immediately.